Hello, and thanks for joining us. I'm Ryan Evans with the Center for Agricultural Profitability at the University of Nebraska-Lincoln, and this is part of our center's regular webinar series. We usually do these every Thursday at this time at noon Central Time. Of course, you can find out more about our center and see a full schedule of upcoming webinars on our website at cap.unl.edu. Here at the Center for Ag Profitability, we frequently highlight the work of our Nebraska Extension colleagues who are working in the rural and community development spaces because we see the clear connection between successful farms and ranches and active main streets in rural communities across the state. We frequently collaborate with the University of Nebraska-Lincoln's Nebraska Cooperative Development Center to highlight their efforts in helping groups across the state to explore, implement, and sustain cooperative models in their collective efforts. And today we're excited to hear about childcare cooperatives and some of the work being done here in Nebraska and the NCDC is helping with. To lead the panel discussion today, we are pleased to be joined by Charlotte Narjes, a cooperative development specialist and director of the Nebraska Cooperative Development Center here at UNL. And she'll be leading the discussion about developing childcare cooperatives. And if you have any questions along the way, we invite you to please type those into the Q&A panel or the chat box in your Zoom window. So with that, Charlotte, I'll turn it over to you.
Thank you, Ryan, for the warm welcome. Before I get started, I wanted to introduce a few people to you. One is Cindy Houlden. And Cindy, so they see your face, please say hello. Okay, although I think you actually have to talk, since I think it's only if you speak, they'll see you.
Hi, I'm Cindy Houlden. I'm a cooperative development specialist with the University of Nebraska-Lincoln Cooperative Development Center, and I happen to be officed in Kearney for anyone that's located in the middle of the state.
Thanks, Cindy. And Tammy Day and Beth Shashikant will be speaking later in this session, but please, Tammy and Beth, would you please introduce yourself as well?
Sure. Tammy Day here from Norfolk. My husband and I own Daycos in Norfolk, and we are a part of working on some solutions to the childcare capacity issues in our community.
Thanks. And Beth?
Hi, I'm Beth Shashikant. I was recently hired as the project coordinator for the Norfolk Area Childcare Collaborative, so I'm happy to be working with Tammy and the rest of our steering committee on this great project.
Okay. Thank you. I'm going to share my screen now. Okay. Oops, sorry, I should have. Okay, before we begin, I wanted to just let you know too, Kim Kuntz was planning to join us from California. Unfortunately, Kim is in Montana in a location that does not have very good broadband and internet service. And so we will be going through her slides and sharing information. And then we'll be talking about the Norfolk example. Again, as Cindy is put in the chat, she'll be managing that. Please share your name and name as well as any questions. She'll be able to help link to that. So the reason why is NCD even exploring this? I mean, Ryan already hit it. There's been so many people that have been asking about it. There's been an increased interest. I think Norfolk, for instance, I believe it might have been last August or September, the first time I heard from Norfolk and wanting to know what the cooperative was. But other organizations that many of you know about, First Five and C4K, the Buffett Institute, people have asked, can the cooperative model work in Nebraska and what does it look like? And what we've learned through this process is that there is an interest in learning and working together. And Cindy and I, in working on this, we're really wanting to understand the model and to help introduce that, and hoping that looking forward to seeing how it does evolve in Nebraska. The one quote, which I think many of you know, the lack of childcare costs Nebraskans $745 million per year. I think that in itself explains the demand. Again, Cindy and my contact information, and Ryan gave us a nice overview that we help with cooperatives and formation. Our agenda, we'll first be going through the agenda, the PowerPoint that Kim Coons shared. We were fortunate enough, we're actually funded by USDA Rural Cooperative Development Center. And through that grant, we were able to contract with Kim, who has been researching childcare cooperatives for well over 20 years. She was actually hired by working at the University in Berkeley in California there, and to find some different childcare solutions. And that's how she became connected to cooperatives, was through the work of what she can do. And then we'll learn about the Norfolk Area Childcare Collaborative. Again, Kim, the crisis, the crisis. I'm not going to go through all the details on these slides, but there's a shortage of care, it's affordability, and it's inadequate support for low-income parents especially, and it even middle-income parents a lot. Other childcare crisis facts. Most of them are women, low paying, the turnover rate's high. Many people are in poverty line and they don't get health insurance. And so these are all challenges to why the childcare situation is and these data are actually from California, but you can, if you want data, First Five and the Buffett Institute, there's many resources in Nebraska. And Cindy's going to be putting those in the chat as we go along that you can link to them.
I just did. Both Buffett as well as First Five are in the chat.
Okay, thank you, Cindy. When you think about economics of childcare, these are other facts that you know, but why is it so high? The regulations that keep children safe also increase costs. It's a balancing act of what parents can pay and underpaying the child caretakers. And we're always looking for ways to minimize costs. So the child care co-op structure, there are different membership types. And I think when you think of a cooperative and when you're forming this, and you're going to hear this when you hear Norfolk talk, is that about their story, it is you forming the business the way you want. And there's a lot of going back and forth of what that looks like. But some different membership types are parents, workers, employers, and multi-stakeholder, which could be a combination of all of the above. And so the structure, one of the things that I think was Cindy and I, even when we first started this, we always were looking at the co-op. In Nebraska, a legal cooperative is a for-profit business. And that's how we were initially exploring the cooperative model as a for-profit business. And even when we started working, share a little bit with Tammy, I know that Norfolk was looking for a for-profit business model that would work. The more research that we went into looking at this, we knew that that was not a sustainable model that would give the goals of perhaps higher wages or affordability, long-term sustainability to work. So when you think of that, that's why it's formed as a nonprofit. The membership, it's democratic. That follows so it's formed as a nonprofit, but they follow cooperative guidelines. We are in this presentation, we're not going through the details of a cooperative right now. We can do that another time. But one of the principles of a cooperative is that it's democratic governance, meaning one vote per member. And there's a board of directors that establishes the policies. The board hires and oversees a co-op childcare. And through those bylaws, you can actually define a lot of the decisions that are going to be made, and each cooperative may determine to do different things. How much power do they have the director on determining some things versus implementing the policies, but that's part of the co-op structure. And the status of a nonprofit, IRS identifies childcare as an education, and that is why you can form that way. Again, in Nebraska, we have a legal cooperative law that does not allow us to have it's not going to be called a cooperative, but you can follow the cooperative guidelines. They can qualify for the 501c3, and the majority can't have a financial interest. And that would be similar with a cooperative, a regular cooperative as well. So the why a nonprofit charitable, we've talked about the affordability throughout this. It's tax exempt, eligible for grants, tax deductible donations. And again, they govern democratically, and members receive service at cost. Generally, if you can, hopefully that cost includes improvements upon the facility, but the goal of this nonprofit is not to pay dividends back to those that are investing. So why a child care co-op? Again, it builds a program that best fits the needs of the members. And I think that's what's listening to Norfolk and the opportunity to watch them in their decisions. What I've really appreciated is seeing the group of people that are together in the conversations of collective decision making. There's hard conversations that happen at times, but they're coming to one voice of what they want, and it's meeting those that are forming that cooperative. It's meeting what best fits that community, and they're taking that in consideration. And it can reduce costs while maintaining quality, and that it reduces costs and affordability, not necessarily for the overall cost of the business. It reduces costs for that parent to contribute and pay for their care. The child care cooperative parent model is one of the, there's three, we went through those already, but the parent model is the oldest, dates back to the 1920s, as you can see. Many times the parents, they form because there was a need for childcare and people come in and out, and parents volunteer time that helps to reduce the cost. The one model is Hilltop, and this is in Kim's research. This is one that she highlights that was formed in 1951. And as you can see, it's very diverse, and part-time and full-time options are available. A quote from this particular group, as you can read, is with family members involved, the transition from home life to school life is easier. A child's self-esteem is boosted, and both parents and child develop a dynamic learning relationship that carries into the future. And other things that I wanted to share this, we actually do have a parent cooperative in Omaha, a Montessori, that was formed in 1984. And I've had the opportunity to meet with them. And right now it's, children 18 months to 6th grade. They are trying to figure out how they could potentially offer from infants as well. And they have a very active parents. And when you think of turnover, one of the things that stood out is that they have people that have been working there since the inception of in 1984. And so it shows the commitment of that sustainability. And people, even after their children have gone through the program, continue to come back in and contribute to that in their volunteer time in order to help maintain that model. Some of the findings that when Kim did her research quite a while ago, and she continues to update, but she wrote a book at the time on bringing families together, but that parent involvement linked to positive outcomes for the children, and that parents actually learn to be parents when they're actually being part of the process and learning, and the families form lasting bonds with other families, and I think that's why they continue to work together. The other model, which we'll be hearing a lot more about when Tammy and Beth share their story, but as the employers, as our childcare stakeholders. The childcare challenges contribute to the worker shortages. That $745 million that was with the Buffett the First Fives research report. The cost to employers is where some of that number comes from. So when you think of the benefits of the employer, it's about recruitment, retention, reduces absenteeism, boosts company loyalty, increases job satisfaction, and increases productivity. Those are the reasons employers may join or want to consider forming a child care state cooperative, an employer-assisted one. Some examples that Kim has from California are the Geo Kids parent-employee model. And in this one, all the employees are of one business, and they get the on-site care and come in. We have examples of that in Nebraska as well, where there's one employer that has contributing to have a place for people to go. And then Geo Kids, they have the way they're organized. The board is made up of parents and an employer representative. They provide space at minimum rent, and parents do pay for care, and participation is required. What Norfolk is doing, and an example that we'll hear about, a short one in North Dakota in Hazen, but is that more considered an employer consortium childcare cooperative, and that you can combine parents and with the employer as well. And there's choices each way that you can do that, where the parents maybe are working at the company and they become part of the board as well. But it's real important, which we'll talk about later, to have key decision makers involved in this process. But employers share risk and benefits, and rarely free for employees, but combined efforts. You can see some of the benefits to how they can help reduce costs. It's through rent-free site, utilities, bookkeeping, meal service, equipment sharing, and benefits to the child care workers are all options that can be considered when that group is determining how. And again, each cooperative is different based off their assets. So Hazen, North Dakota. This was, as far as I know, and from Kim, and now Norfolk is in the process of forming the first example of an employer consortium in Hazen. There wasn't any licensed childcare center, and 8 employers worked together to form this. How they did this is they purchased a local church, and it's been open since May of 2017. As you can see, it's licensed for 88 people, that subsidizes the director's salary and benefits, and it commits to pay for spaces for the employees. They and the board employers actually are part of the board, along with parents on the board, is how that's evolved. And that's how the Energy Capital Cooperative Childcare is formed. They also, one of the benefits that they were able to have is in North Dakota, compared to Nebraska, where we're a public power state, in North Dakota, their power is cooperatives. And one of the cooperative power company in that area actually identified an employee that served as a role similar to Beth in what she's doing. And as a principle of cooperatives is community and working with other cooperatives to help them move forward. And to help this child care cooperative form in North Dakota, they made a decision to have that an employee help with the project management, moving it forward. The final cooperative model that we're going to just share right now is a worker cooperative model. And in that case, the workers are the members, and they form. Philadelphia is an example that we'll talk about a little bit, but again, it's democratically make policy decisions. A key is that they are ineligible for tax exempt status. But as this example in Philadelphia shows, they actually formed a nonprofit that works in concert with a for-profit business to help move forward. They now have 2 locations. And again, similar to the parent cooperatives when Kim did the research, but in this example, many of the people that are involved have been there for a long time. They don't, the turnover rate is not as high. They have a vested interest in it, and they move forward. And the reason this one formed was because there was lack of infant care. And so these parents, that's how they ended up in 1988 forming the cooperative, and they continued. Then the child care cooperative, part of it, including workers. This is, I'm thinking here, sorry, these are Kim's slides, and I'm reading, it's all of a sudden like, I should have read this one a little bit more. So childcare is an industry where collaboration of stakeholders works. And so when you're thinking about it, one of the comments that you'll hear sometimes on the workers is that, I've heard Kim talk about this, is that people think that the workers will just want to increase their salaries and they won't take into consideration. And what Kim's found in the groups that she's worked with where the workers are involved, they are just as conscientious as the bottom line is the employer and looking at things. It really, it's a quality of care and for children and mutual respect. It becomes a really open communication and models where that's happened. And yet it can be a challenge because you have differing interests, but yet it really can help in the long run having everyone involved together. Then including employers and parents and teachers, it increases stakeholder engagement, embraces partnership, draws on legacy of parent co-ops. And so this is another model that can be. And an example of this is the Children's Center in Stanford. And this group that's actually formed by the co-op governed by the parents and the teachers has been so valuable that they're actually going to open another facility because as you can see, the success prompted the university to contribute $15 million to a new, larger facility. So one of the successes is this engaged group of people working together. So when you're considering though, childcare, these are operational facts, which those of you that are on, I can't see the chat. I'm sure there's a mix of people that are service providers, childcare, or those interested. Bottom line, there are high operational costs. For optimal effectiveness, childcare centers operate at cost. If you don't have the slots filled, it's costly. And including the diversity of membership, meaning the employers, parents, and teachers can maximize the effectiveness of that childcare. Cindy, I know has probably already put this in the chat, but these are resources. Hopefully in the very near future, Cindy and I will have a page on NCDC that we start highlighting Nebraska resources, and if you have a cooperative to link. But there's already, we'll be linking when it comes to actual childcare criteria to many of the other resources, but mainly trying to put good cooperative information up there. I'm excited now to move to the Norfolk Area Childcare Cooperative. We've had so many questions or inquiries about the cooperative, and it's excited that one group's moving forward. And again, their goal, I'm going to let them turn over now. And Tammy and Beth, please move forward. Thanks.
Okay, thank you very much, Charlotte. That I think gives us a lot of good background. And I think what it highlights for me is that it doesn't have to be one specific structure that we all adopt, but I think there are going to be some commonalities that communities can use going forward and do what makes sense for their community, because people who live and work in these places know what's best, right? So, but I do think this is a way to get some capacity built in our communities around early childhood education and care that is sorely lacking. So I'll just give you a brief overview, and Charlotte's going to make the slides go with what I say. So we're gonna do that. Norfolk, like any other community in the state and probably in the country, does not have enough quality childcare capacity in our community. So as an employer, that's concerning to me, right? I have lots of people who work here who have kids under the age of 6, and they need places for their kids to go so they can come to work, right? So we started looking at this as a company about 18 months ago, and initially really just tried to figure out what could we do for Daycos to help our employees with this childcare and learning issue. And what we realized very quickly was that this was a much bigger problem than maybe we could make a dent in if we went on our own. So our goal became to try to learn as much as we can about early childhood care and education, and try to figure out what role could a business play in helping solve this problem. And so we talked to lots of people doing this work. In Nebraska, there's been a lot of progress made in very, what I would consider smaller size communities under 5,000 people, where they can come together, build one beautiful community childcare center. And that usually is enough to really reduce their capacity gap. In a place like Norfolk, Kearney, Columbus, Lexington, North Platte, one center doesn't really work, right? Unless we want our kids to be in a place that has 600 toddlers running around in it. And I'm not sure any parent wants that. It'd be like sending your toddler to junior high. So we knew that, wasn't going to work here. We also know, and Charlotte's alluded to this, that there's a lot of math problems in the early childhood care and education space. Workers aren't paid enough. Most don't receive benefits. And so they've been fleeing the profession. Obviously, in this labor market, you can work almost anywhere and make a higher wage and receive benefits than you can in lots of early childhood spaces. So we knew that was an issue. We also know we don't have enough spaces for these kids. And we have learned a lot in the last decade about the importance of that birth to 5 time frame for kids and all the things that develop at that time, and how critical that is for our communities. So where we have landed after many conversations, and I don't know if you want to go to the capacity gap slide, Charlotte. just gives you an overview of Norfolk. We have about 25,000 people here. And so our capacity gap, working with Communities for Kids, was officially around 433. And then we had a very large center close. And so our gap is now hovering around the 600 kid mark. And so we have lots of different efforts that have been trying to address this problem. We've worked on the in-home provider side, trying to remove financial barriers to startup of in-homes. We have a nonprofit who has purchased the former large center that closed and is trying to reopen that under a different sort of model there. We have, you know, some smaller in-home providers trying to figure out how to open second sites. So it's going to take a lot of different approaches to tackle this. And the one thing that we hadn't been seeing is businesses being at the table and driving solutions. So we, you know, knew that we wanted to accomplish, maybe go ahead a couple of slides. We wanted to, as business, help close the gap, make sure we have high quality care, address some of the staffing issues by increasing wages and benefits, trying to, you know, figure out how do we create sustainable operational funding in that space. Because we know kids are in and out of there all the time, funding is up and down. And then trying to figure out if we're going to make something, let's make something that might be able to be utilized by other people going forward. So if you go on a couple of slides yet, Charlotte, making the case for employer-led initiatives. So why would a business even want to have this conversation, right? And I think there are lots of reasons, which you can see here on the slide, but we know that businesses, you know, good news, bad news, are finally paying attention because they can't hire enough people, right? In Nebraska, I think the latest I heard was we have 80,000 potentially unfilled positions in our state. And wouldn't we all like to have more people back in the workforce to stabilize that labor supply, you know, and figure out a way to, you know, make employment in Nebraska more attractive, right? As a business owner, we're always trying to figure out how do we make our place the best place to work, because we want to hire the best people here, right? So does everyone. We also know that being, especially I think in Nebraska, we're deeply rooted in our communities, and caring for our community is really a part of many companies' way that they approach the world and the way they do business. And so how do we help solve this community problem and increase sort of the long-term attractiveness of our places, right? So that was the case that I made to the employers that I started talking to when I started to realize that maybe it was time, you know, to look for a solution that wasn't waiting on government, that wasn't hoping that, you know, somebody else would figure it out, right? But it was actually bringing business owners to the table and saying, you know, we've got to do something. So the next slide actually shows, and this will be true for your places too, we needed to figure out some numbers to talk to people in our area. And there, luckily, I think it was early this year, there was a study or a survey done, and they asked people why they had left the workforce. And 31% of Nebraska parents actually said they left the workforce because they couldn't find childcare for their kids. And so in Madison County, if you look at the last census data, that's 550 people who are not working because of childcare issues. And so for us, that's a big number. Every time I say that to an employer, they're thinking, wow, I'd love if there were 550 more people, you know, looking for work, being in the labor pool. So that is a big driver of this business-led conversation. The other part is that surveys have noted that not only is it the people who aren't working, but we also know the people who are working, this is affecting them negatively, right? Maybe their in-home provider gets sick. Somebody has to stay home. They're distracted because they don't know, you know, okay, my in-home provider goes on vacation in 2 weeks. What am I going to do? I'm having a baby. I can't find a spot for my infant. So people who are already employed are also stressed and affected by this capacity issue that we have. So it is really impacting our workforce and the way that we continue to do business in our state. So for us, it was important to get that local data so we could tell our story. And like I said, everyone will have that, so you can kind of work those numbers for your own place. So where did we land after all of these conversations and making the case? We are building, and I said this to Cindy earlier, I said, well, I'll tell our story, but we're kind of building the bus as we drive it down the road, right? Like, we don't know what we're doing. I mean, I'll just be honest. We have a great idea and we have really smart people at the table, and we have lots of even statewide partnerships, you know, working with Charlotte and others that are helping us navigate, you know, how this might work. And so we are building a 501c3 childcare collaborative, right? That's what we're calling it. And it's operating under the principles of a co-op model, so a cooperative model. So that collective decision-making, the community engagement, trying to find a way, you know, not to make money on this endeavor, but to break even in a way that creates sustainability for the entire system. So the way we have our setup, we currently have 8 companies in Norfolk of various sizes who are committed to this project. So we formed a steering committee. We've hired Beth, who has been amazing to help us guide the project. And we've all made a small contribution for some startup costs to get us going. And then that group is now figuring out, okay, here's this really great idea. And in Norfolk, it'll end up being, you know, our first site will be 50 kids. So we can pilot this, test it out, work out the bugs. But we know that over time, this childcare cooperative model will have to scale in our community. So it will probably end up being multiple micro centers across the community, hopefully in existing infrastructure, so that we can keep the costs down. But we're trying to start small and then figure out how do we move forward. And so the employers who are at the table have guaranteed, much like a slide Charlotte showed earlier, they have guaranteed that they will provide sustainable funding for this model. So each employer will say, I commit to covering X number of slots. And then obviously as we scale, people will have more slots and we'll cover that. We're figuring out, you know, what kind of baseline financial contribution is required from each employer. So we're really sorting out a lot of these details. But we've kind of run some numbers and have gotten to the point where we think the cost might be $240 per week per child to make that happen. So however that shakes out, you know, that's what we're looking at. Business members can decide how many slots do they want. They can decide also how much to subsidize those costs for their employees. So you hope building the model, we can bring those costs down, right? That's higher than we'd like it. So we're hopeful that doing some things like in-kind contributions and different things like that, we can bring the total cost per slot down. But employers also have the option to subsidize that for their employees, because that can provide an attractive recruitment and retention tool, right? So I might say, you know what, if you work at Daycos, not only do you have guaranteed childcare if you work here, you also will have that childcare cost subsidized by us at 25%, right? So employers have that flexibility depending on the wage earning potential of the positions they have in their company and different factors like that. So we're really trying to create as much flexibility for the business member as they engage in this process, but also having some base level of commitment to the project so that it can have that long-term sustainability across time. So that is just a brief overview of the model. I'm trying to think, Beth, what else am I missing? You want to throw anything in here?
So yeah, that's the brief overview. And, you know, a lot of it has been theoretical up to this point, and now we're actually starting to kind of get into the details, you know, working on a set of bylaws for the organization. As we're going through the IRS filing for our nonprofit, we are looking at, you know, what could our budget look like? You know, what kind of funding do we need to be thinking about? And then all these different pieces, like, you know, building our own center, you know, that's one of the pieces of it, is taking a space and building our own center, but then Also, can we possibly partner with existing childcare centers within Norfolk who maybe have capacity that's not being utilized for whatever reasons? What are the barriers to that? Is it because you can't hire enough people to work? How can we help with that? So there's just a lot of pieces that we're looking at and trying to put it all together.
That's a great point. So we do have the build out of a, capacity in physical spaces, but we also are meeting with every childcare provider here, and mostly center-based, because oftentimes the centers are licensed for a higher number of kids than they can actually have due to staffing. So trying to figure out, how does this childcare collaborative come alongside those centers that currently have physical spaces and provide some sort of operational, funding and support that allows them to maximize that licensure space that they already have. Because it doesn't make sense to build out new spaces if we already have spaces that are underutilized. So trying to be a good community partner in that way. We've also kicked around ideas like, perhaps this collaborative could facilitate some sort of childcare substitute pool and become a central hub for filling those vacancies, which we know is a stress point for centers, even for small in-home twos where they may have one staff person. Having somebody be sick or gone can really throw off your ability to provide that consistent, sustainable care. So maybe we have a role in that. So really just trying to figure out, how do we be a good community partner, raise, that kind of rising tides raise all ships mentality. Maybe if we can help figure out some of these problems and start making some progress, then everybody here wins, and hopefully the overall quality increases and our capacity in the community increases. So let's go to the second to last slide, Charlotte, just two more. Yeah, so if you're curious, how did this work? I spent a lot of time trying to figure out what in the world we were doing for a while, and that's okay, because that's what our company is about. We're trying to figure out how to solve problems for our employees and our communities. So finding someone who can kind of jumpstart that conversation. And then we created a steering committee. Once we could tell, I first went to the people in my community that I know do business differently, and they're willing to consider new ideas. And so we had those conversations, we got people on board, and now we have a formal steering committee, which formed in May. We do have a parent representative on that board. She happens to work at Daycos, but she is a parent of 2 children under the age of 2. And so she is there providing the parent perspective for us. We have providers that support us in that effort. 2 childcare centers are working with us. We have people like the UNL group, C4K, Nebraska Children and Families, First 5, lots of people coming around to support. How do we build something like this and give it the best chance to be successful? And so now we're even to the point where we have subcommittees up and running, focused on different areas of this project so we can keep things moving forward. We have Beth kind of herding cats, making sure all these people are moving in the same direction. And we recently filed our articles of incorporation. We're getting all of our sort of, legal pieces and parts in place, and really having decisions and conversations about, okay, so we've talked about this, but what happens in this case? And how does this look in reality when we have kids in spaces? And so really digging into the details, but we had to start up high and think about a concept first. And so we are further down the road. So don't be discouraged by oh my gosh, it seems like so much. It's taken a while to get here. But hopefully all this work we're doing fast tracks that for other people, and you don't have to go down that same kind of long and winding road of trying to figure out what to do. So we are here to help and answer any questions people might have. I'm going to stop talking and just see, where we want to go next with this, but that should give you a good overview of what we're working on.
Tammy, while you were talking, we actually had some questions pop up in the chat. So I'm just going to go ahead and ask them of you and Beth right now so that you can address them. The first one was when you were talking about the gap. Has anyone had feedback from community members who think the gap number is inflated? What could change their minds with stories and testimonials from parents help change minds?
I will tell you that isn't a sort of naysayer view I've gotten. I always say, there are people who question anything that someone tries to do right in every community. And we've gotten lots of things like that people are afraid of and whatever. But I haven't gotten that one. So I don't actually know how to address that, except sometimes what I've had to do is just kind of let those things go and really focus on forward motion. Because if you spent all your time convincing everyone and get everything perfect before you launch, then you're maybe, who knows how many months or years down the road before you even start. So, Beth, have you heard that or have any insight there?
No, but I'd like to add that I don't think it's inflated. And I will say that I hear stories, I've only been involved with this project since September. And so before that, my kids are all older. I don't have kids, I don't have childcare needs. But now, since I've been involved with this, just hearing conversations around me, friends who need childcare, people in the neighborhood, who say maybe they have to put their child out in Battle Creek because that's the only spot there was. They live in Norfolk, they work in Norfolk, but they drive to Battle Creek just to drop their kids at daycare. That's the only place available. Or, their kid goes to one place 2 days a week and then another place the other 3 days a week because there isn't a full-time spot for them somewhere. And so, even in your communities, if you don't think that, there's just not enough spots, are they the spots that people actually want? Is it actually meeting the needs for your community members? So that's something to think about too.
Great
Cool.
point.
Perfect.
I was going to add one thing that I observed, Tammy, when you were forming. You had, I don't recall how many businesses initially that you invited to the conversation and one-on-one. Some were not interested.
Right.
You didn't try to convince them to come along. Some are watching and they may come along. And then the ones that you were able, they're willing to do the work to help move it forward.
Yep.
And granted, Norfolk is larger than maybe some communities on the call. I think that it's working with the willing and people that are willing to make decisions together. I just thought that helps because you are going to have the naysayers.
Yeah. Yes. And we had to move, at some point I had to stop talking to people about the idea and actually start moving forward. And it's like any new thing that comes along, right? If you look at a bell curve, there's some really early adopters who are like, yep, let me get in on this. Some people have to kind of watch and see if it's even going to be a real thing, right? I had even employers tell me our employees don't have issues with childcare. And I thought, well, one, you don't know that, right? Maybe they do. We have, what parent wants to say, yeah, I have childcare, but it's not great. And I wish I didn't have to take my kids there, right? And we know those people are already working. So they have figured something out that allows them to come to your place of employment. So sometimes it's just not being in a place where you can think through the thing fully. But again, I'm like, who wants to go on this journey? That's who you want at the table because those people will be invested.
A second question is, can you expand on what you mean by micro centers? Will there be startup funds to support these micro funds, or will that fall on the business owner?
Yeah, that's a good question. And again, I'm speaking in sort of imaginary future, right? But in my head, 50 kids, is nice, but that is not even close to what we need here. And so I think about small centers, like the first site will actually be in the Daycos facility because we have 5,000 square feet of unfinished space, and 5,000 square feet equals about 52 kids. So what other companies in our co-op have space that they'd be willing to shift into this childcare focus? It is much cheaper to find those kinds of places than to build a brand new facility from the ground up. I mean, we know even in the last 5 years, the cost of construction has gone up dramatically. So that's what I meant by having lots of micro centers. I think it's just going to be finding where the next place goes. And we've already started to hear that, right? We have an employer who said, well, I have a building that we own that we're not using, right? Maybe we could have 100 kids in there. So it's like, how do you come together with the assets that the community already has to try to reduce those costs? And in case anyone's interested, there's more information, and we're trying to figure out what does it look like if you're the host site, right? Because that's a whole different set of things to figure out. But we have been working on that as well.
Awesome. And then a question that just popped up. I am wondering about the partnerships with the existing childcare centers in your area. My program also has a higher license capacity than those enrolled, and it is due not to low interest from families, but because we cannot find enough qualified staff members that are willing to do this hard job without benefits, specifically insurance benefits.
Mm-hmm.
My question is this: if you are partnering with these programs, is your business able to somehow extend its insurance benefits to teachers?
Yeah, there's a lot of things in that question. I can tell you we're in early days conversations with our current childcare centers here in Norfolk. The first question obviously is, do you have capacity that's unutilized? And then through one-on-one conversations with them that Beth and some of our facilities committee are having, it's why is that? And what are the barriers? And what do you think would be helpful? And I think a lot of times it'll come down to funding so that people can provide those wages and insurance benefits. So that's what we're guessing. But we need to get through those conversations first, because those providers will know best kind of what is driving some of that gap. But we also know that at the, there are much bigger issues than we can solve too, right? Wouldn't it be wonderful if, as a state, we had an insurance pool that was available to childcare providers? Because it's very difficult if you're a small center to have insurance for your employees. So scaling, having that, the benefit of having lots of people in that pool is really critical. But that's probably not an issue we can tackle right now, but at the state level, I would love to see, something like that happen. We know it happens for other kinds of employment. What about something in this early childhood space? So there are things that I think at the state level need to be addressed. We also have a lot of kind of barriers around fingerprinting and some of those kinds of issues that I think if you have, the ability to advocate for some of those things at the state level, I think that would be helpful. I kind of wandered off the question there, Cindy. Sorry.
No. I think that's a great, because you were at the Thriving Conference, as was I, and I think some of our attendings were. And at one of the panel discussions, Cambridge Public Schools was a presenter, and they have a childcare center that is partnered with Cambridge Public Schools. And their solution to that question is the childcare center employees are employees of Cambridge Public Schools. Sure. And have access to the same benefits that the school employees have access to, just like they were a paraprofessional within the school system.
That's great if you can have
so how they work through it. And so your idea of, could we have a state pool? Could we do this? Could we do this? It's kind of like, what opportunities are there within your community? And this is exactly what the school superintendent said, is we just put our heads together and said, this is one way we can address it within the community of Cambridge.
Yep.
So yeah, I really liked your answer, actually. Another question, or basically, I think this is more of a comment than a question. In some circles of thought, there is a gap between the number of providing quality care for children versus the license capacity. For example, is quality represented by one teacher with 4 infants? And I think that kind of goes with what both you and Beth said with respect to that gap. And the person who asked that question about insurance said she liked your answer. So
yeah,
you did a great job. What can I say?
Yeah, maybe a community has to figure that out here. Maybe in Northeast Nebraska, we have to create our own, pool. I don't know, but it'd be nice to have some people, smarter than me working on things like that so that we could roll those into these models that we're trying to build out.
this is back to Charlotte. This is the very first question that popped into our chat, and I kind of answered it, but I do want to know if did I miss input. We need to do or get a feasibility study for a childcare facility in one of our rural communities. Does anyone know who does these? You know, within Nebraska, we've got C4K, we've got development districts. I think we've got a couple representatives of the development districts in Nebraska on this webinar. Department of Economic Development, Center for Rural Affairs, Nebraska Extension, and then Nebraska Public Power District will do them as well for partner communities. And then there are private consultants you can come on. Do you guys know of anyone else? And the questioner was not from Nebraska, they were from Nevada. So my thought, I know cooperative development centers. I know Margaret and Marla are on here, sometimes do feasibility studies, universities, state departments, private consultants as well. So those were what popped in to my mind.
The other thing I would just add, and I think Norfolk could emphasize this more, but that they have existing childcare facilities on their working with you and defining this. You also had one of the communities that recently formed a childcare share their finances of what that looked like. And so I think working at least in Nebraska, and I would hope in Nevada, that's why people have been very willing to share information, knowing that you have to go line by line. And I think in the example, if I recall right, that you were given by someone that recently formed, the existing childcare provider centers actually looked at it and saw where it needed to be increased. And I think where C4K and others can even help you is, you know, whether you're taking people on tours all the time or what that means, those are all costs you have to incur. I think in that education. That reminds me, Tammy, I don't think that you shared, that is part of the quality of care that you're wanting to provide in your childcare, that there'll be standards for people to be partners and to do things. You're not what that means. That was a decision you made early on.
Yes. Yeah. We didn't want to provide more capacity at a lower quality level. And I know there've been a lot of efforts over the last few years to increase quality across the board. And so we're hoping to have some leadership in that area. We have our current center providers. We have our local family coalition, Norfolk Public Schools, lots of people willing to help us navigate what that quality looks like and what does it actually mean in the day-to-day. So.
Perfect. Charlotte, this question's for you, and I'm just going to answer it yes before I even give you the question.
All right.
We have a newer daycare building. It's just hard to find workers, so it recently shut down. It's so hard finding workers, especially in a rural area. Any tips? Our town is up the creek right now. Does the Nebraska Cooperative Development Center mentor a town on how to get the co-op started? Do you or don't you?
Yes, we do, Cindy. And I think because we're learning together, I would like to say up front, and that's what's been great about working with Norfolk, and even all of, I'd say, the people that have been working in this area, whether it be C4K, First Five, all of them know that we are learning this model with you. And so Norfolk, you know, each community is different. The size of that community is different, that we would be happy to guide you along the way. We try to ask open-ended questions to help you think through. And the real nice thing is right now we still have a contract because of our funding through USDA with Kim, who has been working in this area for over 20 years. And that's, I just say that's invaluable, that we will reach out to find answers. And she's actually willing to come to Nebraska someday and maybe do some things. So far, it just hasn't been, we haven't figured out the need. If we bring her here, we want to make it worth her time and those that are interested.
And of course, we're always, I was going to say, we're always willing to talk to other people. That's how we got as far down the road as we have, is through people being willing to share their story with us. And I like that collaborative approach. And that's really why this model is so collaborative and using the cooperative principles, because you know, we don't gain anything by being territorial and hiding all of our secrets, right? The way this whole state, you know, grows and continues to be better is if we work together. So you could reach out to Beth or myself or Charlotte, and she can connect you to us. We have no trade secrets. So
one other partner that we've, I think, mentioned many of them, if we didn't throughout this, but the Nebraska Community Foundation also has been trying to help, and they've been part of exploring this. And I think, in fact, I believe between C4K and Nebraska Community Foundation, that's how we first got connected to Tammy. And they've been helped you in your process as well to get started. So
yes.
Just a shout out to Jeff Yost. He happens to be from Red Cloud, Nebraska, and he helped form the nonprofit daycare in Red Cloud, Nebraska. So he's been a part of that formation process.
Yeah. And many of the Nebraska Community Foundation affiliated funds across the state in Red Cloud and different places like that have gotten a lot of local support from their local funds. And actually, in some cases, those funds, even for us, our Norfolk Community Foundation Fund is serving as our fiscal agent in this process until we have, that full incorporation go ahead. So we are working with them for all of the contributions that we receive, making any payments we need to make. So if you're fortunate and have a fund in your community, I think that's a great place for a conversation, because that's what those funds are for, is making sure that communities have the things they need to grow and thrive.
Awesome. Couple comments in the chat. Mike Feakin, federal marketplace for employee benefits, because it can be cheaper for employees to get benefits through the marketplace for insurance. And then Margaret Bow, I guess Kim Kuntz is who you need to call if you're in Nevada, because with the California Center for Cooperative Development. And we will send out the slide deck with contact information for individuals as well, so including Charlotte, so you can get a hold of us.
One other comment I saw with Margaret, and she mentioned North Dakota, they were a part of this as well in initial conversations with Tammy, and then Kim, and talking about how Hazen was formed. And they're also very willing to share information and meet too. And the nice thing I'd say about Hazen, that's in a town that's 2,300, so you're a lot smaller with fewer, and they found a way to succeed.
Yep.
Oh, well, I was going to just say first, because I know it's turning back over to Ryan, Tammy and Beth, thank you so much. You've helped make this webinar, and for being willing to share the journey at the beginning. We've had so many inquiries, and that's why it's great that they're so willing to do this, because we're learning. And if you want to explore this, we'll be learning with you as well. And Cindy, you can contact Cindy or I with the NCDC. And of course, Tammy and Beth have shared that. Ryan, thank you.
Yeah, thank you, Charlotte, Beth, Tammy, Cindy. We really appreciate having you on today. Again, I am Ryan Evans with the Center for Agricultural Profitability at the University of Nebraska-Lincoln. We're glad to host this webinar today as part of our regular Thursday series, which we do every week at this time, noon Central. I'm putting a link in the chat box to where you'll be able to find the recording for the webinar. That should be posted later this afternoon if you want to revisit it or share it with somebody who was unable to attend. And then we'll also try to link the slides there if you're willing to share those. So with that, I want to thank all of our panel again for presenting today, and thank you so much for attending. Hope you have a good rest of your Thursday.
Thank you so much, Ryan.